Hello, so this is chapter 26, the biopsychosocial model of addiction. 1. Biology. The bio part of the biopsychosocial model, 1 of 5. Definition. The biological component of this model are the anatomical, structural, and molecular substrates of a disease such as SUDs. History. Dr. Benjamin Rush suggested alcoholism was a disease. Process. Natural reward paths in the brain can be activated by drugs. Pharmacological reward potential. Biological determinism. Jelinek's work. He argued that alcoholism is a disease, like cancer or ammonia. Proposed 4 stages: pre-alcoholic stage, prodromal stage, physical dependence, and chronic stage. The model offered a new paradigm for physicians to use when assessing a potential AUD, broke from moral deficient model. Genetic inheritance theories. Importance of environment or life experience was recognized. Heritability for type 2 alcoholism was higher than type 1 alcoholism, suggesting vulnerability that was transmitted from father to son. Epigenetics. Environmental forces can activate genes. Neurobiological theories. Neurological pathways are established and strengthened by experiences. The biological differences theories. Attempts to identify biological distinction between those who were and who were not alcohol dependent. The dopamine D2 hypothesis. At least 5 different dopamine receptors in the brain. Neuroimaging studies. Orbital frontal cortex and anterior cingulate gyrus, digestive systems, and trick nervous system. Physiological. What is meant by disease? Where does choice begin and end? Methodological. Research drawn from animals. Reactions to the Jelinek model. Reactions to the genetic inheritance theories. Neurogenetic determinism that absolves responsibility for behavior. Addiction may be polygenic, and genetic heritage may account for as little as 10% of risk for developing a substance use disorder. Reactions to the epigenetics model. Reactions against the dopamine D2 receptor site hypothesis. Reactions to the biological vulnerability studies. Findings regarding this have been mixed, may not indicate a predestination to addiction. Challenges to the neuroplasticity aspects of the disease model. Challenges to the brain imaging studies. Challenges to genetic modification treatment approaches. It remains theoretical with little practical value. The medical model and individual responsibility. Theories about cravings, urges, and such are based on reports from those who were unsuccessful at resisting. Researchers failed to show those with an SUD truly lose the power of self-control. Often, substance use requires several active decisions points in order to proceed. Spontaneous recovery estimates that as many as 75 to 95% of those with an SUD will eventually recover on their own. Definition. The impact of psychodynamic learning, motivation, interpersonal interactions, and personality factors on substance use behaviors. The moral model. Addiction viewed as weakness, perhaps a character flaw. Learning theory, various forms over the lifespan, coping systems theory. Personality defense theories of substance use disorders. Attempt to justify unacceptable behaviors through psychoanalytic concepts. The psychological component of the biosocial social model. Behavioral theories. All behavior can be understood in terms of stimulus-response cycles. These theories are very deterministic in nature. Cognitive behavioral theories, psychoanalysis, the power of unconscious and conscious motivations, and the addictive personality. This theory is strongly deterministic. Applications of the psychological component of the BPS model. Assessment, neuropsychological assessment. It reveals level of impairment. Individual or group psychotherapy. Cognitive dissonance. Why do we engage in behaviors we know are harmful? Marital and family therapy. It is meant to assist family members learn how to deal with issues relating to SUD. Reactions against the psychological model of an SUD. Reactions to the moral model of SUDs. Reactions to the alcoholic personality theories. Nothing more than a clinical myth. Can this be a self-fulfilling prophecy? Challenges to the characteristics defense theory. Illusions of correlation. Challenges to the behavioral psychological theories of an SUD. Insurance companies reluctant to pay for treatment due to inadequate research evidence to support them. Challenges to the learning theories of SUDs. Reactions to the coping skills theories. Very few criticisms as they are very eclectic. The social component of the biopsychosocial model. Definitions. Attempts to identify and address social factors that contribute to the individual's increased vulnerability to substance use disorders and increase his or her compliance with prescribed medications. First through fifth order relationship levels. The role of the substance use in a culture. Subcultures within a parent community, family and or peer influences, context in which compound is used. Social factors influence individual substance use decisions. Advertising, attachment bonds, cost, environmental factors, expectations, hopelessness, individual life goals. Social factors influencing individual substance use decisions. Legal sanctions, mass media, medical care, music, parenting, peer group / social support. Religious affiliation, increased social support, non-drinking norms, opportunity to gain relief from suffering. There's also the sex ratio, social norms, and victimization. Continuum of the intervention into the SUDs involves prevention, universal interventions, selective interventions, indicative interventions, indicated interventions, treatment, and maintenance. The Drug Abuse Resistance Educator, quote-unquote DARE program, quite popular through limited effectiveness, potentially even counterproductive. Some support for a program focusing on peer interaction, refusal skills training, and resetting norms. Critics suggest such programs continue because they provide the illusion of doing something, even in the absence of any hard evidence of efficiency. Flaws. Further dictamize breach between biological and psychological models of SUDs. Reinforces stigma of mental illness, poor behavior, not a disease, psychosocial poorly defined, and antagonizes medical professionals. So that's it for this chapter. Thank you for listening.